Hello, my name is Julie Hebert, and myself, along with Jim Hall, are the Hebert Group, and we're your employee benefits administrator, broker. And I'm here to go over your benefits for Quip for the year beginning July 1st, 2023. We have moved our open enrollment time just a little bit based on some changes from All Savers last year. So if you're used to doing this a different time of year, July 1 is our new time for this year. So this year, we're going to move the medical to Cigna. The rest of the benefits are going to stay the same. So TechQuip will continue to pay 80 to 90% of the employee premium and 20% of the dependent premium. And we're going to just run through this briefly. There's some information at the end from Cigna that will be helpful since they're new. So as I mentioned, we're moving to Cigna. So it's going to be important for you to give your new cards to your doctors when you go this year and let them know that you've had a change. We're going to continue to offer two plans that are structured identically to how your All Savers plans were. You have a PPO plan that you can use the Cigna Open Access Plus network, which is their largest network. And then it does provide out-of-network benefits and can be easily used anywhere in the United States. Plan number 2 is an EPO. It just basically means that you can use the same network as you can on the PPO, but you have no out-of-network benefits unless it's an emergency. So it's important that you utilize a network provider and stay in that network unless it is an emergency. So this would not be the best plan if you live in Louisiana or Oklahoma. Here's a brief overview of the plan. We have, as I mentioned, they're both the same network. The biggest difference between the two plans is going to be the fact that you have out-of-network benefits and you can go outside of Texas on plan number 1. Plan number 2, you are restricted to the network and the state of Texas. So they both have a $3,000 deductible and a $6,000 family deductible. Both plans have 80% coinsurance by the carrier, 20% by yourself. So you reach the maximum out of pocket. On plan 1, that's a $7,350 maximum out of pocket. Plan 2 is $7,900. The copays do differ slightly. On plan 1, it's a $30 copay. Plan 2 is $25 to go see a primary care physician. The specialist visit is $60 and $75. The urgent care copay is $100 on the PPO plan, $50 on the EPO plan. Everything is covered 100% on all your wellness. So be sure that you go and get your well check done. You can get vaccinations taken care of. You can have colonoscopies, mammograms, anything that's considered preventative care can be covered 100% on both plans. The emergency room visits are $300 copay plus your 20% coinsurance. Please note that prior authorization is required on these plans for complex imaging, MRIs, things like that. The prescription copay is a $15 copay for the generic drugs and $35 for brand name. Non-preferred brand name, $75, and specialty is $25. And the premiums are listed there. We're encouraging you to enroll at mycigna.com. We'll talk a little bit more about that at the end as we go through some slides about Cigna. The United Care, make sure you have an urgent care facility that is close to you where you live and where you work. If you notice, the urgent care copays are $150 versus $300 and $300 to go to the emergency room. So if you can handle something with an urgent care visit, it's going to be much less expensive. This is giving you information about how to find your in-network providers. So that's very important. Again, we'll go over that just a little bit more at the end. TechQuip does continue to provide a $25,000 term life insurance policy. Please note that is reduced as you age by 35% at age 65, 70% at age 70. If you have a change in your status, such as divorce or marriage, you may want to update your beneficiary information, and you can do that in ease. Long-term disability is provided through MetLife. It's paid for 100% by TechQuip. After you're disabled for 90 days, that benefit picks up and it pays 60% of your salary, up to $6,000 a month through Social Security retirement age. Dental insurance is available for you through MetLife. It is a PPO type plan. So you want to make sure, again, you're finding a dentist. There's information on the end about that as well. You can go and get your teeth cleaned twice a year. That's covered at 100%. You can get basic x-rays done. If while you're there, they say, uh-oh, Julie, you have a cavity, you need a little filling done, they're going to pay at 80%. You're going to pay at 20% after a $50 deductible. If, on the other hand, they say, oh, no, I'm sorry, it's actually, we're going to do a crown, they're going to pay 50%, you're going to pay 50%. We also have orthodontia care. The lifetime maximum on the orthodontia benefits $1,500, and this does only apply to children. And the dental benefit for the year is a $1,500 amount. That the premium did go up just a little bit. You'll notice there. The voluntary life insurance, you can be purchased through MetLife from $10,000 to $500,000 on yourself, and you can purchase 50% of that on your spouse and $10,000 for each child. If you're a new employee, the guaranteed issue amount is $50,000 for the employee, $25,000 for the spouse, and $10,000 for the children. If you change the amount you want after your initial eligibility period, you will have to complete an evidence of insurability form to have that coverage granted to you. You can also purchase vision insurance through MetLife. You can get exams and material copays are $20. You have a $150 frame allowance, and there's the monthly premium on that. This is open enrollment, and any changes that you make right now will be effective July 1. Dental and vision, those changes would be, you want to make a change there, that would happen and also be July 1 effective date. This is talking about what happens if you turn 65 during your enrollment period, what to do there. New employees have 30 days before they're eligible to participate in benefits. This is information about COBRA. If you were to leave TechQuip and move on and you wanted to continue your coverage, this is information about that. So this is what I was talking about on the mycigna.com. So here's how to register on the mycigna.com. You can access virtual care. You can look for in-network care. You can get preventative care. You can also sign up for free identity theft protection, which is a service that Cigna provides, which is really nice. When you log on and get registered, you can either do it through the computer or you can actually get an app. There's an app for everything these days. So you can find in-network doctors, you can get cost estimates. You can also do a lot of pharmacy transactions within that site. So that's nice. You can get a print or a digital copy of your Cigna ID card. This is talking about the virtual care using the MD Live program. It's kind of like a phone a doctor. You can call them and they'll call you back or put your request in online, and they can help you with some simple ailments that save you a doctor's visit. There's information about preventative care. There's quite a few resources for behavioral health care that are available to you, and there's information there about that. If you do take a specialty medication, we encourage you to look into that area of the website. They have some great information. If you have chronic conditions, there are some case management programs like diabetes, heart disease, renal failure, things like that, where they can help you with those conditions and try to get the best benefit for you. This will help you. This is just some tips to save money about where to find prescription drugs, where you can go for care, choosing the right provider, and being proactive about your health care. Here's some information about 90-day prescription refills and how to do that. That's easy and convenient and less expensive. Here's information about Express Scripts Pharmacy. That's the online pharmacy. Again, that's an easy way to keep routine medications coming at your fingertips and not even ever have to go out to the pharmacy. Here's information about that MD Live program. This gives more specific details about what all they can treat over the phone. Things like acne, allergies, cold and flu, diarrhea, earaches, fever, insect bites, any kind of skin infection. This gives you information on how to take advantage of that program. This is encouraging you to make sure that you're using the proper level of care when you have something go wrong. It's to help you save time and money. So basically, if you can use a virtual care center, convenience care clinic, or a healthcare provider's office. Then as you have more serious symptoms, less time to react to the issue, you could use the urgent care or emergency room. So basically, they're trying to encourage you to stay out of the emergency room unless it really is a life-threatening emergency. And it's giving you some examples of those things. Again, here's information on how to register for the MyCigna app. It gives you some more information about what all is available to you there. This is digital servicing for your MetLife benefits. So this is for your dental and your vision. This is telling you how to find providers. You can do online appointment booking. They also have an app for the dental and the vision, and you can look at claims there, find providers, all those great things. You can even look at customer reviews on dentists in your area. Here's how to find a vision provider. If you have the vision insurance, there's information on that. And so there's a lot of information here. We hope that you can utilize some of this information to get the most out of your benefits. If you ever do have any questions or run into any problems and these resources can't help you or Alma's unavailable, I'm always here. My information's right here on the front, my name, my phone number, and my email. I'm always happy to help. We appreciate you guys. And if you have any questions, please reach out. Thank you.